Hi, my name is Tracy. Erin, Callie, and I are going to present a video on goniometric technique for shoulder flexion.
4 joints contribute to the shoulder complex. They include the glenohumeral, sternoclavicular, acromioclavicular, and scapulothoracic joints. Shoulder flexion consists of 2 parts glenohumeral motion and 1 part scapulothoracic motion. This is called scapulohumeral rhythm. For every 3 degrees of flexion, 2 degrees comes from glenohumeral joint and 1 degree comes from the scapulothoracic joint. During the late phase of flexion, greater than 90 degrees, 25 degrees of posterior rotation of the clavicle allows for the last 30 degrees of upward rotation of the scapula to occur. Normal shoulder flexion is 0 to 180 degrees according to the American Academy of Orthopedic Surgeons and the American Medical Association. Biceps brachii, anterior deltoid, and coracobrachialis synergistically work together to flex the shoulder. Serratus anterior, upper and lower trapezius all contribute to the upward rotation of the scapula, while the middle trapezius counteract the strong protraction force from serratus anterior.
Range of motion measurements are important to fully understand a patient's movements and limitations. These measurements will aid in the identification of movement problems related to the shoulder complex components. It is also important to establish a patient's baseline function, which will allow the PT to monitor progress and to set appropriate goals. Range of motion measurements can assist in documentation, which is a key element of the billing process. Contraindications for the use of goniometric testing of shoulder flexion include acute injury, dislocation, unhealed humeral fractures, immediate post-surgery evaluation, areas of high osteoporosis, and in conjunction with pain medications or muscle relaxants.
According to research published in 2012, Kolber and Haney found that goniometry was a good measure of mobility, as excellent intra-rater reliability was demonstrated for goniometry in the shoulder. Validity for intra-tester is good, while inter-tester validity is a bit lower. However, flexion, abduction, and external rotation have a fairly good inter-tester reliability, especially compared to measurements of extension, horizontal adduction, and internal rotation. This is because it is more difficult to standardize the position and goniometer placement for extension, horizontal adduction, and internal rotation.
To properly measure shoulder flexion, a large goniometer should be used. Your axis or fulcrum will be placed over the lateral aspect of the acromion process. The stationary arm will be lined up with the mid-axillary line of the torso, and your movable arm will stay in line with the humerus. A great landmark to use for this is the lateral epicondyle of the humerus. So you will start with your patient's arm in a dependent position, visually confirm that they can zero. Great. Ask the patient to flex their shoulder with their thumb leading. That way you minimize the risk of impingement. Place your hand on the patient's thorax so that you can monitor for any compensations and feel for end feel. Compensations that you might see would be ribs protruding anteriorly, an excessive amount of lumbar lordosis, an increased anterior pelvic tilt, or shoulder hiking. Good. Go ahead and bring that arm down. Perfect. So you'll ask your patient to start in a dependent position, then go ahead and line up your goniometer in an estimated position of where you think they're going to be, and then have them repeat that flexion moment or movement. Good. And align your goniometer as you did before. Then go ahead and have them relax their arm down once you've taken that measurement. And next you'll do passive range of motion. So you will move the patient's limb for them and take another measurement here and then relax. Good. So normal shoulder range of motion for flexion is 0 to 180 degrees. It's typical to have 5 degrees of difference between your active and passive range of motion.
Hi Tracy, my name is Callie and I'll be your PT today. How are you doing?
Hi, I'm good.
How's the shoulder?
A little bit of pain.
Okay, so today we're just going to do a test to see how the shoulder's looking and how it's moving. So I'm going to have you raise your arm above your head, and we're going to have your thumb point toward the ceiling on the way up, and then it's going to point behind you once you get up there.
Okay.
That make sense?
Mm-hmm.
All right, so if I could just have you stand up and take off your shirt.
Okay.
Okay, so you can turn towards you a little bit. Perfect.
Okay.
All right, so yeah.
Callie's visually confirming that Tracy can 0.
Okay, so now I just want you to do that motion for me that we just described.
Okay, so thumb to the ceiling.
Perfect. All right, and come back down. Looks great. Okay, so I'm just going to find a landmark for taking the measurement, okay?
Okay.
Okay. All right, go ahead and do that motion one more time. Okay, so that looks like about 150 degrees.
Callie's just keeping a finger between the goniometer and Tracy's skin.
And come back down. Okay, so now we're going to do the same thing, and I want you to relax your arm and let me bring your arm through the motion.
Okay.
All right. Okay, so that's about 146 degrees. Excellent. Okay, come back down. All right, so normal is usually 180 degrees, so you're a little bit less than normal, but they both look even, which is what we want to see. So
Excellent.
looks good.
Great.
Thanks for watching.